Assalamu alaikum. We are going to discuss the morphology of infarction. We will also discuss some scenario based MCQs. So let's start our today's topic with the classification. We can classify infarcts either on the basis of color or presence or absence of infection. On the basis of color, infarct can be divided into two types: red infarct and white infarct. And on the basis of microbial infection, infarct can be divided into two types: septic or bland. First, discuss infarct classified on the basis of color. Red infarct, red infarcts, which are also known as hemorrhagic infarcts, they occur due to several different reasons. It can occur as a result of venous occlusion. We have already discussed in topic of infarction that venous outflow obstruction is a less frequent cause of infarction. Infarcts caused by venous thrombosis usually occur only in organs with a single efferent vein. So here we can write example of ovarian torsion. Second, second point where red infarct can occur is in loose tissues like lungs, while in dense tissues we will see white infarct, which we are going to discuss in couple of minutes. So in loose tissues where blood can collect in infarcted zones, we will see which type of infarct? Red. Third point is in such tissues where dual circulation is present, such as lungs and small intestine, but it is inadequate than what is needed for normal perfusion of tissues. Here, red infarcts occur. If venous outflow is sluggish, we know the result will be congestion. So, red infarcts occur in previously congested tissues. Next point where red infarcts occur is when flow is re-established after infarction has occurred. Like you can say after angioplasty of an arterial obstruction. Here comes a question in mind that how come reperfusion causes infarction? See, because of reperfusion, sometimes oxygen can converge into reactive oxygen species and can cause reperfusion injury. Next, we have white infarct, which is also known as pale or anemic infarct. Like red infarct, we will see where white infarcts occur. So basically, two major causes where white infarct occurs are: number one is if arteries occlude in solid organs. If arteries occlude in solid organs that have and arterial circulation, like we have heart, spleen, and kidney, then due to this arterial occlusion, white infarcts occur. Second one is in such tissues that are so dense that their density is not letting the seepage of blood to adjoin patent vascular beds. From above discussion of red and white infarct, we can compare both type of infarcts in such words that infarcts that are result of arterial occlusion, if occurs in such organs that don't have any dual circulation, they typically become more and more pale and sharply defined with the passage of time, and we term this type of infarction as white infarction. Comparing this with the other type, that is hemorrhagic infarcts, before discussing the basic outline comparison, you should keep in mind that hemorrhagic infarcts are the rule in lungs and other spongy organs. If hemorrhagic infarcts occur, what happens to extravasated RBCs? They are phagocytosed by macrophages. And about heme part, heme iron is stored inside the cell in the form of hemosiderin. If these hemorrhagic infarcts are in small amount, they do not impart any appreciable color to tissues. But if it is in very large amount, then they can leave a firm brown residue, which is quite a common sense thing though. Let's light up the histological findings associated with infarct. So, in most tissues, main histological finding is ischemic coagulative necrosis. In response to this, within few hours, inflammation begins to develop. Inflammation begins to develop along the margin of infarct, along the margins of infarct, and just after 1 to 2 days, it is usually well defined. And we know that after inflammation, tissue proceeds towards repair. We will discuss this repair point in our next part of video. Allah Hafiz.